ThedaCare is proud to encourage healthy, active lifestyles through its support of the Fox Cities Marathon. Dr. David Hirschi is a sports medicine physician with ThedaCare. You're also the medical director for race weekend. So thanks for being with us.
You're welcome.
We're going to talk about running and some injuries that we commonly see, and you're going to tell us how to help prevent some of those injuries.
Okay.
So the way that we're going to do this, we have a word wall with some really common injuries, and we're going to see if we can pick maybe the top ones that you see.
Okay.
All right, you may have to help me out with this one, but all right, let's start at the top here. Let's see, is tendinitis on our word wall for most common injuries? Is that one that you see?
Yep.
Okay, so
one we see.
what is tendinitis?
Tendinitis is an overuse injury of the tendons, various tendons, like your Achilles, your patellar tendon, and it's really when you overwork it, overstretch it, so then the fibers get kind of pulled, or maybe some micro tears in there, and then that irritation creates some inflammation, then pain, and then it gets difficult to kind of proceed and keep going.
Mm-hmm. How do you treat that?
Because it's an overuse injury, you've got to back off. But when we talk about rest, we don't necessarily mean do absolutely nothing. You really back off so that you don't have pain. And then you do a gradual return to sport, running, whatever it is.
Okay, let's see if we can find our next injury up there. Stress injuries, stress fractures, again, one I hear often.
Yep. Yeah, that's very common, especially in runners who are doing longer distances, and or those who are not very active and go to a very quick level of activity. People that try to do the couch to 5K or things like that, if they go too quick, you can stress out muscles, and then those muscle attachments to the bone. And commonly is that shin splint, right? That muscle of the anterior lower leg pulls on that bone, and it starts with a shin splint, and then it can progress to a stress response, and then if you keep going and don't treat it properly, they can then end up with a stress fracture. So, yeah.
Okay. Next one up there, sprain. Okay, I don't feel like this happens to just runners, right? Like this could happen to a lot of different people.
That's true. And in fact, it may be more common in people that are doing more of a cutting sport,
Sure.
Stop and start. But runners commonly get sprains of the joints. You can twist your ankle on a rock, and a lot of runners like to run on trails and things, and so yeah, you can sprain the joint, and you can sprain the ankles or the knees or really any joint.
Okay. All right, I'm going to ask this question, probably a silly question. Strains, are those different than sprains?
Yeah, that's a great question, and yes, they are. So we talked about sprains. Sprains are relative to the joint, so you twist the joint and the ligaments there get injured, get stretched. And a strain is related to the muscle, okay? So it really is equivalent or the same thing as a pulled muscle. So you often hear, oh, I pulled my hamstring or I pulled my calf muscle. That is what a strain is.
Okay, so how do you prevent those types of injuries?
Prevention comes with really doing a good job at conditioning your muscles prior to your run or your event. So making sure you're gradually increasing, whether it be your distance or your speed or your time, your pace, and so not jumping in too fast. And also listening to your body. If you're running, you're doing, let's say you want to do a 10-mile run. Well, if you start feeling a little tightness in a muscle at mile 7, it might be best to back off. Either slow down, take a break, stretch out, so that you don't push through and then all of a sudden that muscle pulls.
Yeah. Okay, these are really good tips. Thanks for playing that one, Dr. Hirschi. So in addition to the support that you provide, ThedaCare also offers some additional resources for the runners.
Yeah, absolutely. There is a training guide on foxcitiesmarathon.org that people can download, and every week there's training runs that we actually have physical therapists at, and they can see you and support you in any issues you may be having and help guide you as well.
All right, this is wonderful advice, Dr. Hirschi. Thanks for being with us.
You're welcome. Thanks for having me.